I want to finish by talking a little bit about variants of concern. These are something that have entered our lexicon in the last few weeks, particularly because of one variant that was detected in the UK to start with that was associated with increased transmissibility, rapidly increasing numbers of people being infected. And this virus is an RNA virus. That means it has a single genomic sequence, which means that every time it replicates, there's a potential for a mutation or a change to happen. I liken it to, it doesn't have a spell checker. So sometimes the genetic code can get it wrong and misspell. And that can, in some cases, lead to a virus that has some sort of ability to take over or spread faster, gives it an advantage. And this is one of the things that we've seen in the UK, that the virus variant that was detected in the UK meant that it could be transmitted more easily to others. And more worrisome, in the last week or so, there's also been some data that suggests it might cause more severe illness. Sometimes it's very difficult to tease that apart because we know the more people that are infected, the more people who are going to have serious illness. But there is some concern about that. And that is very concerning to us as well. In BC, we have been using whole genome sequencing, so that's doing the sequence of the about 30,000 base pairs that make up this virus's genetic material on an ongoing basis to help us understand how the virus is moving in our population. And it was one of the things that helped us determine early on that we were seeing increase in people coming in from Washington State, from Europe, etc. It's how we detected the first importation of a virus that somebody had picked up in Iran. Right now, we do about 750 whole genome sequences on positive tests per week. But the BC CDC lab, as working with partners across the country, is developing a screening marker so that we can screen thousands of samples per week, hopefully get to all of the positive samples being screened for this, and then if this marker lights up, doing the whole genome sequencing on those targeted isolates, we call them, or the swabs, the virus that's being detected from cases. So right now, we are doing whole genome sequencing to look for the variants of concern that have been identified internationally. So there are many other variants out there, slight changes. As we've seen, it changes about 2 mutations per month. But these ones are concerned because, as I mentioned, they have increased transmissibility, and there's some concern that the variant from South Africa may give it some ability to, the vaccine may not work as well. Some vaccines may not work as well in that variant. So this is what we have as of yesterday here in British Columbia. We've sequenced about 4,500 cases, and we've detected both either the UK or the South African variant in 28 cases. Of the UK variant, 14 of those cases were directly were people who had histories of travel directly from the UK, from Ireland, from Dubai. There's a few other countries as well. And there were 5 individuals who had this variant who were close contacts of somebody who traveled. So far, those variants seem to be relatively contained, but it is concerning to us that we continue to have transmission in our community of these variants, the UK variant in particular, and we're increasing our screening and targeting of outbreaks and other places to make sure that we are finding and containing this variant. Of concern to us is we also have 8 cases of the variant B1351, which was first detected in South Africa, that were acquired locally. And in 5 of these, we do not know where that person acquired the virus. 3 of them were contacts of somebody who had acquired the virus either from travel or locally. So this is more concerning to us. Again, we don't seem to be seeing widespread variants here in the province yet, but we are stepping up our surveillance and targeted surveillance to better understand where we are. And if for those who are following, we have seen an increase. We had only a few of these detected, even as early as last week, and we've had double the number within this past week. So this is something we are watching and are of great concern.